You're listening to the Quint podcast.
In the shadow of the coronavirus pandemic, Finance Minister Nirmala Sitharaman gave a fresh impetus to the Indian healthcare sector as she tabled the Union Budget 2021 on 1st February. The very first item on a budget checklist, the health budget, with a total outlay of Rs 2.24 lakh crore, witnessed a nearly 137% jump from last year. The Finance Minister said that the fight against coronavirus will continue well into 2021, as she identified health and well-being as one of the 6 pillars of the budget. Apart from healthcare, the budget gave major emphasis to infrastructure and agriculture sectors. Amid chants to repeal the farm laws that has caused countrywide protests for more than 2 months now, Sitharaman said that her government was committed to the welfare of farmers. Talking of infrastructure, the government announced investments in highways, roads and metros in 4 states where assembly elections are due soon. That is Kerala, Tamil Nadu, Assam and West Bengal. Besides, a host of announcements were made on the disinvestment front, including the government's decision to privatize 2 public sector banks and 1 general insurance company. Though the budget has been received favorably by the stock market, with some saying no bad news is good news, let's dissect some of the key highlights from the budget: health, agriculture and infrastructure. Does the health budget have enough financing needed for vaccine distribution? How will the new budget allocations for poll-bound states play out for the BJP? And what about India's farmers? In today's episode, you hear from Dr. Amir Ullah Khan, who is a development and trade economist and also an advisor to the Bill and Melinda Gates Foundation, Aditya Menon, the Quint's political editor, and Kiran Visa of the Ryutu Swarajya Vedaka. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. Acknowledging that the fight against COVID-19 will be ongoing, the Finance Minister launched the PM Atmanirbhar Swasth Bharat Yojana with an outlay of Rs 64,000 crores over 6 years to strengthen health infrastructure, including developing institutions that can detect and cure new and emerging diseases. She also announced an additional fund of Rs 35,000 crores for COVID vaccination development.
I would like to say that the investment on health infrastructure in this budget has increased substantially. Progressively, as institutions absorb more, we shall commit more. Taking a holistic approach to health, we focus on strengthening 3 areas: preventive, curative, and well-being. Health systems. A new centrally sponsored scheme, PM Atmanirbhar Swasth Bharat Yojana, will be launched with an outlay of about 64,180 crores over 6 years. This will develop capacities of primary, secondary and tertiary care health systems, strengthen existing national institutions, and create new institutions to cater to detection and cure of new and emerging diseases. This will be in addition to the National Health Mission. The main interventions under the scheme are support for over 17,000 rural and 11,000 urban health and wellness centers, setting up integrated public health labs in all districts, and 3,382 block public health units in 11 states, establishing critical care hospital blocks in 602 districts and 12 central institutions. Strengthening of National Center for Disease Control, its 5 regional branches and 20 metropolitan health surveillance units. Expansion of the integrated health information portal to all states and UTs to connect all public health labs. Operationalization of 17 new public health units and strengthening of 33 existing public health units at points of entry, that is, at 32 airports, 11 seaports, and 7 land crossings. Setting up of 15 health emergency operations centers and 2 mobile hospitals. And setting up of a National Institution for One Health, a regional research platform for WHO, World Health Organization, Southeast Asia Region Office, 9 biosafety level 3 laboratories, and 4 regional national institutes for virology. Nutrition. To strengthen nutritional content, delivery, outreach, and outcome, we will merge the supplementary nutrition program and the Poshan Abhiyan and launch the Mission Poshan 2.0. We shall adopt an intensified strategy to improve nutritional outcomes across 112 aspirational districts. Universal coverage of water supply. The World Health Organization has repeatedly stressed the importance of clean water, sanitation, and clean environment as a prerequisite to achieving universal health. The Jal Jeevan Mission Urban will be launched. It aims at universal water supply in all 4,378 urban local bodies with 2.86 crores household tap connections as well as liquid waste management in 500 Amrit cities. It will be implemented over 5 years with an outlay of 2,87,000 crores. Swachh Bharat and Swasth Bharat. For further Swachhata of urban India, we intend to focus on complete fecal sludge management and wastewater treatment, source segregation of garbage, reduction in single-use plastic, reduction in air pollution by effectively managing waste from construction and demolition activities, and bioremediation of all legacy dump sites. The Urban Swachh Bharat Mission 2.0 will be implemented with a total financial allocation of 1,41,678 crores over a period of 5 years from 2021.
However, according to experts, this number of rupees 35,000 crore is not in sync with market realities. Even Adar Poonawalla, CEO of Serum Institute of India, which has developed the COVID Shield vaccine, stated in September last year that rupees 80,000 crore will be required to cater to the country's requirement for COVID-19 vaccine. Here is what Dr. Amirullah Khan had to say about this.
If you look at the numbers, you will find that the expenditure on health last year in 2021, the revised estimates put it to 82,445 crores. And what has been allocated for this year is 74,602 crores. So it's actually lesser than what we spent last year. That is one. The second issue is that on vaccination, you will find that the Finance Ministry has allocated 34,000 crores, whereas the most gracious estimates are that we need at least 80,000 crores. So if that's going to be such a big difference, and that 50,000 crores is the deficit that we have on vaccinations, then it means that in this year where vaccinations should have been at the top of our list, we will not achieve any fast rate of vaccination. Of course, the headline does seem to say that a total of 223,000 crores is a great increase, and that now takes us to about 1.8% of GDP. So when we look at that 223, obviously several people will celebrate, but the fact is that the total spending is still less than 2% of GDP. And even the economic survey had promised or had said that it should be at least 3% of GDP. So therefore, on these three counts, I don't think that we are doing a great job.
As Dr. Khan said, the headlines are in the numbers presented by the Finance Ministry. The budget focuses on strengthening health infrastructure, with announcements for establishing critical care units and hospital blocks across primary and tertiary centers, and integrated public health labs to be set up in each district. According to Dr. Khan, these infrastructure investments will have minimal impact on the sector. He says greater focus should have been on increasing bed capacity and investments in healthcare education.
What we wanted to also hear was about how Ayushman Bharat had moved towards a universal healthcare coverage. But there seems to be neither any indication nor any will to move towards that. If we this year, if this year we don't resolve to get UCC in, then when will we do that? It is very important for us to take a look at how we will be able to just revamp the entire healthcare sector and move towards a universal healthcare system. The next point, there was absolutely no mention about how we are going to solve that glaring problem that we faced, which was by way of the absence of healthcare personnel. We found that we were among the worst countries in the world where the doctor to patient ratio was concerned. And there is no mention of how we are going to increase the number of doctors. Last year, the finance minister had made a big statement saying there will be bridge courses and we will not only produce enough doctors but also export them. And nothing like that seems to have happened. There was no mention of that in this year's budget. And finally, the point that I wanted to make was on hospital beds. When we started off the pandemic, one of the most miserable visuals that all of you projected on various media were people running helter-skelter, looking for beds and dying, waiting outside hospitals. The bed to patient ratio is really very poor. It's much poorer than Vietnam or Cambodia, and we seem to have done nothing. In fact, the economic survey actually tended to very bizarrely rationalized it by saying that health infrastructure doesn't seem to have any correlation with controlling a pandemic. I just don't know how even that hypothesis could be validated or even could be stated. But the economic survey said that, and true to form, the finance minister had nothing to say on improving the number of beds or the number of ICUs or the number of ventilators.
Moving on from healthcare, at a time when the government is facing flack from farmers over 3 farm bills passed in Parliament last year, the agriculture sector merited interest. Among the highlights are, the finance minister introduced an agriculture cess on specific goods, including alcoholic beverages, gold, silver, cotton, peas, apple, petrol, and diesel. She talked about MSP's significance, saying, and I'm quoting her, "The MSP regime has undergone a change to assure price that is at least 1.5 times the cost of production across all commodities. The procurement has also continued to increase at a steady pace. This has resulted in an increase in payment for farmers substantially. The government has also increased the farm credit target for financial year 2021-2022 to rupees 16.5 lakh crores. However, there was no mention of the 3 farm laws or any guarantee to continue with the MSPs. Here is Kiran Visa of the Ritu Swarajya Vedika on what all key government schemes which were not mentioned or highlighted in the budget.
Items which the finance minister did not talk about at all. Firstly, the doubling of farmers' income. She just mentioned it in maybe in the beginning of the thing. I may have missed it, but doubling of farmers' income was a target which the government had announced in 2016, and the 6 years is going to end in 2022, which means that this is the last budget year for achieving the doubling of farmers' income. No report card has been presented about what is the current income level, how far have we reached, and they have not even mentioned that they are going to reach this, in 2022. So this is so what is missing? Doubling of farmers' income missing. No talk about the Fasal Bima Yojana, which was another flagship scheme and which has actually failed. If you look at the last year's expenditure and allocations for the Fasal Bima Yojana and the number of farmers enrolled, it has a sharp drop from the previous years. So instead of covering 50% of the farmers like they've said, now it is even less than 20% of the farmers that the Fasal Bima Yojana is covering. Another scheme not mentioned, the PM Kisan. Once again, though they had said 12 crore families will be covered, which will be increased to 15 crore families, they have only reached 9 crore families and not gone beyond that. There have been major demands from the farmer organizations that it should be extended to tenant farmers, women farmers, all the cultivators. Nothing about that. Similarly, nothing about the NG-NREGA scheme, especially in this phase of extreme slowdown of the economy, in fact a recession. Enhancing the rural incomes and putting money in the hands of the rural poor so that the purchasing capacity increases would have been a no-brainer. but there has been no enhanced allocations announced for the MGNREGA scheme. In fact, in the lockdown, one of the saving graces in terms of providing some kind of a livelihood to all the migrant workers who returned back to the villages was the MGNREGA scheme. However, under the NREGA scheme, there are 100 days of employment which are guaranteed to every rural family, not to a household, not to every card holder. Those 100 days were completed by June or July. That means in the first 3 or 4 months of the financial year, most of the households had run out of their 100 days allocation. So which means that the government should have actually enhanced that to 200 days and increased the allocation for NREGS. Nothing of that sort has happened, and even in this speech, the government has not mentioned anything about NREGS. So these are the major missing ticket items that I see. And the very last point that I want to make is on this whole issue of minimum support prices and the markets and procurement. So one thing that I would like to highlight is that the government in 2018-19 once again had announced a major scheme called GRAM, which promised that 22,000 rural hearts, which are small agricultural markets which are existent at village and cluster of village level, to be enhanced in terms of infrastructure to make them accessible, to provide accessible infrastructure markets to the farmers within a 10-kilometer range of any village. That was a promise. There was no mention of GRAM scheme here, which means that it has completely fallen off the radar of the government. But if you look at the figures, actually less than 500 rural hearts have been upgraded. In fact, it may even be just close to 200 out of the 22,000 which was promised. And the allocation for this GRAM scheme has been consistently cut in the last 3 years. Similarly, the price support scheme and the market intervention scheme, which are meant to ensure that farmers get MSP, which the government has announced, the allocations for that have also been drastically cut. Last year, it was only 2,000 crores. And this year, they have not even talked about that. Similarly, the PM Asha scheme, which was once again announced with much fanfare in 2018, whose purpose is to ensure that every single farmer gets the minimum support price that the government announces. Once again, that was cut from 4,000 crores in the first year to 1,500 crores to 500 crores in the last year. This time again, no mention of that. So all the schemes which are actually meant for ensuring market infrastructure or ensuring that farmers get MSP have seen no mention at all. And I suspect that when the budget documents are actually released, we will see that there is either truncated allocation or maybe just these schemes have even disappeared. That we'll need to wait and see. So therefore, the commitment of the government to ensuring remunerative prices to the farmers is completely missing from this whole thing. There was just one token mentioned that Agriculture Infrastructure Fund will also be lending to the APMC markets for improving their infrastructure, but no specifics there. And if the government is bringing in laws which actually completely undermine and lead to the collapse of APMC mandis, there's no point in saying that we will try to enhance that infrastructure. So therefore, these are the main points that stand out as far as the budget speech is concerned, which was very sparse actually as far as agriculture is concerned.
From agriculture, moving on to infrastructure with a focus on poll-bound states. From quoting verses from Rabindranath Tagore and the massive allocation of funds, the influence of the upcoming polls in West Bengal, Kerala, Tamil Nadu and Assam was palpable in the budget. The finance minister announced a 3,500-kilometer long national highway corridor in Tamil Nadu. The budget for the project is Rs 1.03 lakh crores. The Tamil Nadu National Highway will also include the Madurai-Kollam National Highway. The 1,100-kilometer long national highway corridor in Kerala will also get an investment of Rs 65,000 crores. This will also include the Mumbai-Kanyakumari National Highway. While Tamil Nadu is expected to go to polls in April and May of 2021, Kerala is also poll-bound around the same period. In West Bengal and Assam, where the BJP has been trying to make inroads in view of the upcoming polls, the finance minister announced special funds for the road and highway development projects in these states during her budget speech. In the budget, Rs 25,000 crore has been allocated for roads in West Bengal and Rs 3,400 crores for road infrastructure development in Assam. We spoke to the Quint's political editor, Aditya Menon, on how these new budget allocations will play out for the BJP party in the upcoming polls.
The budget has promised an investment of 1.03 lakh crore for building 3,500 kilometers of roads in Tamil Nadu. In Kerala, it has promised 65,000 crore for building 1,100 kilometers of roads. In Assam, it has promised 34,000 crore for 1,300 kilometers of roads, and in West Bengal, it has promised 25,000 crore for building 675 kilometers of roads. In addition to this, in Assam, they have the finance minister promised assistance to tea garden workers, especially women and their children. So broadly, these are some of the specific promises for the poll-bound states. Obviously, with elections due in these states barely in a few months' time, the government wanted to give special focus to these states. I mean, the allocations are of course important, but by the time they reach, obviously the elections would already be underway. May even be over by then. So I think it's more the symbolism that the government is thinking of these poll-bound states, and naturally one can anticipate that the BJP's communication department will ensure that that these allocations and that the government is doing these things in the poll-bound states will reach will reach the voters in these states, just to show that their interests are being taken care of. Obviously, I mean, will that be enough for to see the government through? I don't think so. To see the BJP through in these states, I'm a little doubtful. Because these aren't really big ticket promises that could change electoral outcomes. If the BJP is doing well in certain states, as the polls suggest that the BJP has a certain advantage in Assam, and that the BJP is unlikely to do well in Tamil Nadu, I don't think these things are going to change just because of the budget allocations. The campaigns have their own dynamics, and the opposition is also trying to cobble up political alliances. So in the end, those things are going to matter much more than these budgetary promises, unless of course the government ensures that some of the benefits reach immediately. But time is not on its side, so it's not likely that this will have a very major impact on the election.
If you like listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.